Hello everyone, welcome back to my channel. Today I would like to talk about an interesting entity that we usually need to think about, otherwise we're going to miss it. So this is a lumbar spine MRI that we're just going to get this study all the time in outpatient or like inpatient or even in the ER setting. We just patients coming with back pain. We usually look for acute fractures in the lumbar spine, and then like degenerative changes is the most common indication for doing this study as an outpatient. So this patient, like imagine is a 70-year-old female coming with back pain. We usually do our regular search pattern. We don't see that much anything obvious. Like if I just do a very quick search into the lumbar spine MRI, I don't see much going on. There are some disc bulges here and there, but they are not compressing the spinal cord that much. I don't see any high-grade spinal canal stenosis. There are like some degenerative changes, but nothing is horrible. There is no acute fracture as far as I can tell on this T2. And also if I look at these stir sequence, there is no acute fracture in the lumbar spine. But just make sure everything in this screen is our responsibility as a radiologist. We also need to look at the soft tissues. We need to look at the spinal column, and also we need to look at the sacrum. That's the area of interest on this study that I just want you guys pay attention. So basically, this is the area that we may overlook if you don't pay attention. So if you look closely in this area, which is basically sacrum, you see that there is a lot of edema. So this is the stir sequence, and whatever is bright is going to be edema because fat is getting suppressed. So you see a lot of edema in the sacrum bilaterally. So if the other side is just like horrible, you see that all these areas that they are abnormal edema in the bilateral sacrum. So make sure on every lumbar spine MRI just take a second and make sure you're looking at this area in the sacrum. If I look at this T1 sequence in the same region, I'm going to see all these areas that they are darkness. So T2 hyperintensity, T1 darkness in this patient. It can be other entities, but the most common entity is going to be some sort of edema going on. And then in older people, we always need to think about fractures, sacral fractures or sacral insufficiency fractures. So let me show you the coronal. So when we look at this sacrum and the causal, we were lucky in this patient we had just coronal. It's not a very common sequence, but in this patient specifically, they acquired this coronal T1. And then you see that we see this edema that we saw in the T2 stir is just going to be showing as T1 hypointensity, and then we see this fracture line going into the sacral aloe on the left, and then probably some sort of fracture also going on the right. So this is a very pattern in older patients, specifically female gender. If you're going to see sacral insufficiency fractures, that is basically, if we do nuclear medicine scan, it's going to be Honda sign. It's called Honda sign on nuclear medicine, the way that we are going to have increased tertiary uptake. Let's look at the dedicated pelvic imaging here. So this patient also, because they had pain, they also acquired separate pelvic MRI, as you see here. So we see all these areas of abnormal edema in the region that we already saw on the sagittal and coronal sequence. Again, stir sequence, we see lots of edema here. So this is basically MRI feature for sacral insufficiency fracture. So if you look at this, again, we are going down. This is a T1 axial through the lower lumbar spine, and then we go to the sacrum. We see all these areas of edema, which is showing as T1 darkness. So the point of this case is always look at your blind spot. So the blind spot on lumbar spine MRI, one of the important locations we have to look is sacrum. Always make sure, specifically in older people, look at the sacral area to look for any associated fracture or specifically sacral insufficiency fractures. Okay, if you guys like this video, please don't forget to subscribe and follow me on this journey for future videos. Thank you.